ఈ గురక అనేది కామన్, అందరూ నిద్రపోతే ప్రశాంతంగా గురక పెడతాం అని అంటూ ఉంటారు కదా. సో అసలు గురక అనేది డిసీజా?
Yes, definitely. Like, this is a myth in the society that people think, oh, he or she is sleeping well, that they are snoring. It is a deep sleep. It is a good sleep. It is actually not. It is actually opposite. So a person snoring means ikkada obstruction unnai. Mukkulo or guntulo obstruction unnai. So if there is a obstruction, the airflow will be not good enough. There will be vibration here. This area is like a straw. If you imagine a straw which is for coconut water drinking, but you are trying to drink a mango juice, what will happen? The straw is narrow. It will get stuck, or the straw will vibrate. So this is how happens in the airway. If there are obstruction in the nose, throat, or if the person is very fat, lot of fat deposition here, so the straw, the air tube becomes narrow, and in the narrow tube, when you are trying to pull air, it starts vibrating and then it collapses. That is the origin of snoring. So snoring, definitely once in a week somebody is snoring. If the person is very tired or after a couple of drink, that is okay. But every night somebody is snoring, that is not normal. That is a disease.
సో కొంతమంది బాగా అతిగా గురక పెడతారు. ఎంత అంటే పక్కన పడుకున్న వారు నిద్రపోలేరు. కొంతమంది చిన్నగా ఈల వేసినట్టు, లైక్ ఇట్స్ లైక్ అ విజిల్. సో ఇలా డిఫరెంట్ సౌండ్స్ ఉంటాయి.
అండ్ కొన్నికి మొత్తం గాలి మూసిపోతుంది. సో దే హ్యావ్ అ చోకింగ్ స్పెల్ అండ్ దెన్ దే లైక్ దిస్, దే సడన్లీ, దట్ ఈస్ డేంజరస్. That is called apnea. At that moment the person is not getting any oxygen. So the brain is getting a red signal, you are not getting oxygen, wake up. So they wake up, again they start snoring. It's like a cycle. So every snoring is not a disease, but the people who are getting those pause, getting this apnea, and the people who are having a morning headache, dull feeling after getting up. Lot of my snoring patient, I ask few leading questions, so immediately I can understand who needs treatment. Number one question is, are you happy when you get up in the morning? Most of this snorer will say, no, I don't feel fresh, I feel drowsy, I feel dull, something is heavy, varuga anupistunda. So these are probably bad snoring. Okay. You can see some people who are waiting in for me, and in the waiting lounge they're dozing. Or you get with them in a cab or in the flight, immediately they will fall asleep. Even in a movie theater they are sleeping. So this is called excessive daytime sleepiness.
Okay, daniki
that is relation. Exactly. So these people, if you inquire, most of them are snorer because at night they are not getting good amount of oxygen. Their brain is tired in the daytime. They easily fall asleep in the office. And the dangerous people who are suffering for many years, they even fall asleep while driving.
Okay.
Lot of snoring patient or obstructive, the bad form of snoring is called obstructive sleep apnea, OSA. So many of the OSA patients meet road traffic accident because of feeling drowsy while driving.